Hello, everyone. My name is Adeswa Obasahin Watson, and I'm the Director of the Suffolk County Department of Health Services, Office of Minority Health, and the co-chair of the Multicultural Advisory Committee. And I would like to welcome you to the second video in our virtual behavioral health town hall series on mental health resources. This series is a collaboration between our Suffolk County Division of Community Mental Hygiene Services, our Suffolk County Multicultural Advisory Committee, the New York State Office of Mental Health Long Island Field Office, and the New York State of Addictions, Services, and Supports. The Behavioral Health Town Hall Committee, as you can see, is comprised of multiple offices that came together to make sure that we had adequate information in all of our health series videos. The local behavioral health leadership staff is made up of these individuals, all of whom have expertise in different areas in reference to mental health services, public health, substance use services, etc. Just before we get to our main speaker on the mental health resources, I would like to share a little bit about our Suffolk County Multicultural Advisory Committee, also called MAC. The mission of the MAC, as a regional committee of the New York State Multicultural Advisory Committee, is to represent Suffolk County. We advise the New York State Office of Mental Health and the Suffolk County Department of Health Services Division of Community Mental Hygiene on policies, programs, and activities regarding service provision to individuals with mental health or emotional challenges who are from diverse racial and ethnic backgrounds. The goal of the MAC is to tear down barriers to recovery, such as disparities in access to treatment, lack of access to quality services, lack of information, language difficulties, stigma, myths, mistrust, biases, prejudices, and discrimination. We also promote culturally and linguistically and spiritually inclusive services. MAC is comprised of at least one representative from most of our behavioral health providers in Suffolk County. This is a list of our membership organizations, and we are constantly adding to this group of individuals to make sure that we are representative of this population within Suffolk County. Myself, I'm one of the co-chairs, Adeswa Watson, and then we also have my fellow co-chair, Anne Marie Montijo. If you'd like to learn more about the Multicultural Advisory Committee, feel free to call the Office of Minority Health at 631-854-0378, or you can email omh@suffolkcountyny.gov. Now I'd like to hand it over to our main speaker.
Good morning, everybody. My name is Janine Yanasello. I am the Director of Adult Services for the Suffolk County Division of Mental Hygiene. The purpose of this video is to raise up the issue of behavioral health needs created by or worsened by the COVID-19 pandemic. It is to reduce stigma attached to living with and seeking help for mental health and substance use disorders. And it provides a more accessible, community-friendly overview of behavioral health services and resources. The goals is to break down barriers to behavioral health services for communities and help people understand that mental health is an important part of overall health, promoting wellness and recovery where we live, work, learn, worship, and play. There are a variety of mental health treatment programs in Suffolk County. There is a wide array of services for both adults, children, and adolescents. I'm going to provide you an overview today of some of these programs. For adults, we have 10 inpatient psychiatric hospitals. We have 1 partial hospitalization program, 8 ACT teams, 10 PROS programs, 29 mental health outpatient clinics, and 1 on-track program. For children and adolescents, we have 5 inpatient psychiatric hospitals, 3 partial hospitalization programs, 21 mental health outpatient clinics, 1 on-track program, and 1 ACT team. So now I'm going to describe to you what some of these services are. In terms of outpatient mental health clinics, clinic treatment provides treatment in an outpatient setting designed to reduce mental health symptoms and the negative effects of illness to improve behavioral health and wellness and promote recovery. Services typically include outreach and initial assessment, including health screening, psychiatric assessment, crisis intervention, medication management, individual, group, and family therapy services. A person can self-refer to an outpatient clinic directly by calling the number of the agency and setting up an intake evaluation or screening appointment. Additionally, a person can be referred by a hospital social worker, a school social worker, or other professional. A list of the agencies that provide outpatient mental health clinic services can be found in the Directory of Behavioral Health Services. This directory is located on the Suffolk County Division of Mental Hygiene website. The link is listed below. The next service is partial hospitalization programs. A partial hospitalization program is an outpatient behavioral health treatment intervention designed to further stabilize symptoms of mental illness. It serves as a step down from inpatient psychiatric units or as an alternative to an inpatient hospitalization for individuals who are able to be maintained safely within the community. This treatment includes an individualized treatment plan coordinated with the client, family, and referring physician or agency, which typically includes group therapy and medication management. A supportive environment created by staff dedicated to maintaining and enhancing the independent functioning of each client. A structured schedule ranging from a full day program, typically Monday through Friday from 9 a.m. to 3 p.m., to shorter half-day programs. Some programs serve adolescents, while others serve adults. The typical length of stay is up to 6 weeks, depending on one's health insurance coverage for this level of care. And again, a list of the agencies that provide partial hospitalization programs can be found in the Directory of Behavioral Health Services. PROS is personalized recovery-oriented services. PROS is a comprehensive model that integrates rehabilitation, treatment, and support services for people with serious mental illness. It serves individuals 18 and older. The hours are typically Monday through Friday from 9 to 3, but some agencies offer evening programs. It provides individual and group counseling and medication management, as well as vocational services. Goals for individuals in the program are to improve functioning, reduce inpatient hospitalizations, reduce emergency services, reduce contact with the criminal justice system, increase employment, attain higher levels of education, and secure preferred housing. To apply to a PROS program, an individual can call the agency to self-refer or be referred by their current therapist, social worker, or care coordinator. A list of the agencies that provide PROS services can be found in the Directory of Behavioral Health Services. OnTrack New York. OnTrack is an innovative treatment program for adolescents and young adults who have had unusual thoughts and behaviors, or who have started hearing or seeing things that others don't. Using a shared decision-making model, OnTrack offers a comprehensive, evidence-based approach to help young people gain skills and get the support and treatment they need to achieve their goals for school, work, and relationships. OnTrack New York is hosted on-site at South Oaks Hospital. For more information about OnTrack New York, you can call 631-608-5570 or email to sohontrac@northwell.edu. For additional information, Please also visit the Suffolk Stop Addiction website at www.suffolkstopaddiction.org. There are some additional mental health services that I would like to bring to your attention. The first is our adult SPOA. This is our adult single point of access unit, and it comprises of care coordination and ACT referrals, assisted outpatient treatment, and single point of access or SPA housing. The first, assertive community treatment or ACT, is an evidence-based approach that offers treatment, rehabilitation, and support services using a person-centered, recovery-based approach to individuals that have been diagnosed with serious mental illness. In Suffolk County, we currently have 8 ACT teams, and each ACT team services 68 individuals. These are ACT teams for adults. Care coordination. Care coordinators develop service plans based on specific needs and desires of the individual, the adult, the child, or the family. They provide supports and service linkages to mental health, medical, and substance use disorder treatment, as well as transportation arrangements, service dollars for eligible recipients, and much more. Assisted outpatient treatment, also known as the Kendra's Law program. As per section 9.60 of the Mental Hygiene Law, AOT, or assisted outpatient treatment, provides for court-ordered outpatient treatment for certain people with diagnoses of mental illnesses who, in view of their treatment history and present circumstances, are unlikely to survive safely in the community without supervision. The single point of access, or SPA housing, is mental health housing that offers several different types and levels of housing to individuals with serious mental illness. Some levels of housing include community residence, apartment treatment level housing, and supportive housing. Applications and information can be found online at the SPA website, which is www.spahousingli.org. Children also have a single point of access system. The Children's SPOA oversees in-home services and out-of-home services for children from young age all the way up to age 21. The preventive services include parent-to-parent, family connect, stay, and youth and family integration. The more intensive services would include children's care coordination, health home care management, coordinated children's services initiative, mobile early intervention program, high fidelity wraparound services, and our youth ACT team, which is assertive community treatment for youth. The out-of-home services would include community residence and a residential treatment facility or an RTF. Let's look closely at each service. The community residence, or CR, provides supervision and structured daily living activities for youth ages 8 to 17 diagnosed with a serious emotional disturbance. It provides 24-hour-a-week supervision. The residential treatment facilities, or RTFs, provide fully integrated mental health treatment and special education services under the direction of a psychiatrist in a well-supervised setting for youth between the ages of 5 and 21. This is a hospital level of care. For both the CR and the RTF, parental consent is needed, or if the child has a legal guardian, consent would be needed by the legal guardian. Some programs are co-ed, and these programs are applied for through the Children's Single Point of Access, or CSPOA unit. The information as to how to contact both the ASPOA and CSPOA can be found in the Directory of Behavioral Health Services.